So now I would like to talk to you about what you can do about it, how you can freeze your biologic clock and preserve your fertility. You don't have to be one of these statistics that we deal with every day now who already is past her biologic clock and can't get pregnant, at least with her own eggs. We can save your eggs, we can save your ovaries, and literally put a stop on their aging. Once you've had a proper assessment with an antral follicle count, and then we can get another blood test called anti-Müllerian hormone, or AMH, but we won't get into that in detail. But once we have assessed where you are in your biologic clock, then we can tell you whether it would be wise for you to freeze it or not, or whether you can just watch it for another year or two and get tested again another year or two. In other words, watchful waiting, or should we act now and preserve your fertility now? So I'd like to just show you a few clips of videos, actually from cancer patients. The reason I tell you about cancer patients is we learned so much from these brave young women. Women in their early 20s who had cancer that was so severe that it required massive chemotherapy and radiation that would have been lethal otherwise, but certainly would destroy their ovaries. And these women survived. In fact, the majority of young women with these terrible cancers nowadays are surviving with heavy-duty radiotherapy and chemotherapy, along with a bone marrow transplant. But they've completely lost their ovarian function and can't have children, unless what we've done is we've either frozen their eggs or we've frozen their ovaries before they undergo this treatment. And then they can have their ovary transplanted back, or we can give them their eggs back with an IVF cycle at a later date, 10 or 15 years later, so that even though they thought they would have to be sterile because of their cancer treatment, they're not losing their fertility at all. Why do I bring them up? Because I'm talking to a larger population now. I'm not just talking to the cancer victims. I'm talking to every young woman. When I talk to the cancer patients 5 years later who have been cured of their cancer, one of their major themes is they feel actually relieved, in fact, grateful in one respect that they had cancer, because now their ovaries are frozen or their eggs are frozen. And their girlfriends are all talking about and worrying about their biological clock. They haven't met the right man yet. They want to advance in their career, or they are married, but their husband and them want to build up more of a nest egg so they can afford a down payment on a house before they decide to have children. But they're worried that by the time they decide to have children, they know about their biological clock, that they may be infertile. These cancer victims don't have those worries, and they tell me how grateful they are. They know that they have frozen ovary that can be transplanted back at a later date, and they don't have to worry about when they decide to have children. So they have tremendous peace of mind. Ironic, because you would think what they went through is a tragedy, but it turned out to be a benefit. And I give that example because if they feel that way, then perhaps all young women ought to find out what their risk is of losing their eggs in the next few years. In other words, where they are in their biologic clock. And if they have that risk, I think it would be wise to have either ovarian tissue or eggs frozen to preserve their fertility. So let me just give you a few news clips from some of these patients that might be of interest to you.
When she found out the chemo would make her infertile, Melissa turned to Dr. Silber. In a simple outpatient surgery, Dr. Silber removed tissue from her ovaries. Since all of the eggs in a woman's ovaries are located on the outer rim, only a small incision was needed to dissect the thin outer membrane from the ovary and remove it. The tissue was then put through a computer-controlled, gradual freezing process.
Now I'll show you another clip that'll demonstrate what I'm talking about.
If a woman is using this procedure to prolong fertility, Dr. Silber will first do an ultrasound on the woman's ovaries to determine if she will benefit from the tissue freezing. By counting the follicles, which are the little black holes in the outer part of the ovaries, Dr. Silber can actually count a woman's eggs.
When you come in and have your antral follicle count ultrasound, Oh, plus some simple hormone tests, but the ultrasound is the main thing. We can tell you where you are in your biologic clock. So let's talk a little bit about freezing of eggs and of ovarian tissue, because I think I made it clear now that with modern cryobiology techniques, very special techniques that have been introduced from Japan, and I must say that we've been leaders in introducing this, but it was developed, these newer techniques were developed in Japan by colleagues who we have incredible regard for. And we have a choice. We can either freeze your eggs or we can freeze your ovarian tissue. Now, it works a little bit differently for each one. For freezing your eggs, we'd have to stimulate your ovaries with hormones the same way we do for IVF, and then we retrieve them as a simple outpatient procedure with no surgery whatsoever, just as though it were an IVF cycle. Now, until only recently, you could not freeze eggs with any reliability whatsoever. But now, with this technique of vitrification that's been worked on for 25 years and finally perfected by Dr. Kuwayama in Japan, with this vitrification technique, we can freeze your eggs with 95% survival. And we can give you the same kind of result with those frozen eggs that we would with fresh eggs in an IVF cycle 10 or 15 years from now. And if we freeze, say, 3 cycles of eggs, you'd have a very good chance of being able to get pregnant at any future stage. Now, it wouldn't be 100%, because even a good IVF cycle, you might have a pregnancy rate of 35 to 50%. So it'd be better to freeze 3 cycles of eggs, and that may be a big deal, but that would be one approach for preserving your fertility, and I'll talk to you about that in a minute. The other approach would be to actually, through a laparoscopy, remove a small piece of your ovary and freeze your ovary. And then 10 or 15 years later, we could transplant that ovary right back to you, and then you can get pregnant naturally without having to go through IVF.